Wow, two people already here. Thank you for joining in. It's been a while, and I'm so glad to be here again. I mean, I've missed the community. I'm sure they've missed me too. If you are there, let's get to know. Please send a message in the chat. I hope you can see. Just drop in a message if you are joining us live. Let's know where you're joining from. A very pleasant evening, everyone. And I'm sure you can see that we have our guest who is ready to deliver. It's a special one today. So I have my brother, my deacon, permit me man of God. Interestingly, I know people who call him pastor already. That's the way it is when you live and live in such a way that people can see God in you. So it's very important. So we are talking about health. Health matters matter. And if you care about your health, I think it should be settled here because we have two experts. And me, I'm just here to learn, actually. I'm here to learn about natural remedies. How much do I know? Do you know that there was a video I did on natural remedies for arthritis, and people have been watching even the short video. They've been watching it, and I mean it's quite engaging. So welcome, Umsworld. Where are you joining from? Welcome, welcome, welcome. Please introduce yourself. I want to welcome you specially. Everyone joining in, let's know where you're joining from. I'm sure you are interested. I can see that you're interested in getting more knowledge, and interestingly you have opportunity to ask questions. So let's do this together. So I want to welcome our speaker. I'll just do an informal welcome now. Waiting for more people to join in. All right, so sir, what do you have to say as we kick off on this live, as an opening remark? Welcome.
All right. For my opening remark, I would like to say thank you very much for having me on this great program. I'm very
Yes.
grateful to my brother in the Lord and fellow um, healthy living enthusiast.
Yes.
Apart from the fact that you are in a medicine, I am a medical laboratory scientist and also a naturopath, certified in natural medicine as well. So we are looking at how we are juxtaposing two worlds that are not actually contradictory, but they are actually complementary. So
Very.
I am a person trained in laboratory medicine and then um, diversifying into naturopathic world. I've been able to bring that synergy from diagnosing properly to using dosages adequately, which is the
Wow.
challenge
Wow.
of medicine.
Wow.
So
So
everything we are going to be talking about today about our healthy living, you are going to have the privilege of knowing the dosages because these are research proven. Some of them are meta-analysis, some of them are clinical trial. So we are talking about this is the modern time. We are the time or the ignorance of olden days. We don't know what natural medicine
mental.
does. No,
Okay.
it does actually. Now we know that there are natural effective solutions that the world is emerging into now, and we must know how to um, present them, and we must know how to accept them with open-mindedness, just like the way we accepted those drugs without questioning. So we should now begin to question as well, but with a good mind, with an open heart, to learn and say, wow, so this can do this, so this is the replacement of this. So if you don't have these drugs available in your vicinity, these are contains the same natural um, um, nutrients and minerals that does exactly what it does. You understand? So it is a complementary uh, world we are in if we want to live longer and healthier. Thank you, sir.
Yes, wonderful. That was a wonderful opening remark. Thank you for that. You know, there's what we call complementary and alternative medicine, which is
Yeah,
embraced actually in orthodox medicine. And I like the fact that it's more about enlightenment, enlightening people, helping the world to know that
yeah,
even some of those concerns that people have had regarding use of herbs, you know, there's a bit of clarity, and the aspect of dosages, which is usually a concern for medical doctors, health professionals, you know, and you know even some patients who may be interested, but they want to be careful that they don't get
yeah,
some complications from using those things. Because even
yeah,
the orthodox medicine, the drugs are also, in a way, they are measured in terms of dosages, and then if not given in the right measures, people
yeah,
overdose, abuse them, and the results will be bad. So we have somebody here from Lagos, Nigeria. Omswad says yes, he or she is highly interested in what we are discussing, as he or she is surrounded by relatives with hypertension. So talking about hypertension, you know, it's one of the common um, chronic medical diseases or disorders, and in fact, it is responsible for most deaths all over the world. Cardiovascular deaths actually is the highest when it comes to mortality in globally actually. So in different parts of the world, people suffer heart attacks, people suffer, you know, what we call myocardial infarction, and hypertension is a leading cause of cardiovascular diseases. So we need to pay attention and keep creating more awareness on these things. You know, just like he or she has mentioned, highly interested because they are relatives with hypertension. So you may be here today and you may not have that diagnosis, but someone around you will need this information we are sharing. So invite somebody here. Don't just be the only one, and let's know as soon as you are joining, and let's know where you are joining from. And if you have any question, please be free to uh, let's have your question, and then if you have any additions, comments, please you can drop in the chat. So thank you once again. So as a matter of introduction, we have here our expert, who is an expert, not just a medical laboratory scientist, expert in natural remedies. I'm sure people are still going to be joining, and people are already watching. You know, numbers may not reflect sometimes. Okay, but we would like to see who and who is here already. That will help us to be able to engage better. So, talking about natural remedies, we will go into natural remedies, but I want to quickly give some information on high blood pressure because we are specifically talking about natural remedies for hypertension and for diabetes. So, high blood pressure is, like I said, one of the most common chronic medical conditions, of course, followed by diabetes and high cholesterol levels. So, those are chronic conditions that are ravaging the world, and we look at different factors. What are the things causing these conditions? Especially talking about high blood pressure and diabetes. The genetic factor is there, whereby we say, oh, if it's happened in one generation or generations before, it's possible to appear in subsequent generations, even though it's not automatic. But there's a gene factor uh, that comes to play, especially with type 1, type 2 diabetes also. So we need to be very much aware of our family history. It's always good to know. And if you visit the hospital, you have to see a doctor. I'm sure you've been asked that question at different points in time. Does anybody in your family, you know, have this? Did anyone have this? Does anyone have this currently? And for those who have more people in the family having this condition, hypertension, there's a risk of them also developing hypertension. high blood pressure. So the diagnosis actually should be made by a doctor, and usually, on the average, generally acceptable, we say normal blood pressure should be less than 120 over 80. That's between 90 to 120 for the systolic. That's the higher value when you check your blood pressure, and then the diastolic should be between 60 and 90 millimeters of mercury. So anything below that is hypotension. Anything above that is hypertension. Though generally 140 over 90 seems to be a reference, even though this may vary with age and different things. Diet can affect, and exercise. So that's what I mentioned earlier about genetics is the non-modifiable factor that may cause hypertension. Also for diabetes. So I'm putting the two together. Now for modifiable factors, has a major influence, and that's why we are seeing more people developing. Young people, sir, are you aware that people in their 30s, 20s are now developing high blood pressure? Have you seen patients, clients like that?
Yeah. I've seen a 16-year-old in my um, laboratory work, 16-year-old with high blood pressure
Mm,
and chronically high, unbelievably high
mm,
high blood pressure. And it shook the whole facility because we're shocked to find such. And I've seen more younger people in the recent times. And
mm,
we know that that is where the precursor for a lot of kidney related injuries are also coming from now. Most times, about 70 to 80% of people with kidney problem, you can almost link them to high blood pressure, which is another kettle of fish entirely.
right.
So it's a serious matter in young people. Yeah.
Right, sir. So age is a factor. Of course, we are seeing more in younger age group, and part of the non-modifiable factor include age. Of course, with increasing age, people may develop high blood pressure or diabetes. Now, because the cells are changing, a lot of things have changed. The cells, the walls of the arteries are thickening, so there's a lot of pressure that the blood that is flowing has to go through. Then also for diabetes. Now, I was trying to emphasize the aspect of lifestyle, which is one of my areas of interest. Our lifestyle goes a long way to determine what happens to us elsewise. Now, do you know that I was somewhere yesterday, and after the talk, one of the questions I was asked is, what kind of sports do you do, doctor? Because I know, they were looking at me that the people around, maybe some of them have protruded belly, some of them are overweight. And I say, of course, there's the genetic factor, there's, of course, the grace of God, but there's the conscious, I'm definitely an active person doing a lot, so that's helpful. But there is the conscious aspect of eating healthy. One of the things I do is to avoid eating late, 7 p.m., 8 p.m. Maybe I'll just take fruits, which is what I advise. Okay. And so that means for people who eat late at night, heavy meals, a lot of starch, unhealthy diets, they have the risk of developing high blood pressure and even diabetes. So we need to look at our diet. Are we engaging more in processed foods? Are you taking more salt than you need? And then, are you hydrating well, or are you going for alcohol? These are things. Alcohol puts people at risk. Smoking, like things that put lifestyle that put people at risk of developing high blood pressure and diabetes. So when we talk about these two conditions, there are symptoms, and some of the symptoms actually include for hypertension. It's called a silent killer, and that's why people have some people around them that just for suddenly, somebody was complaining of a headache, severe headache, and then they developed a stroke, bled into the brain, and something happened. No more. So we have seen situations like that. So it's one of the causes of sudden death globally, hypertension, and symptoms are not there until complications have set in, and such complications include headache, and that's one of the concerns I have. May not have all the time to talk about what my patients do. Sometimes They say I've not taken my drug. Okay, I know when I need to take my drug. It's when I have a headache. I said, what? You are waiting till the blood pressure is that high, and then you have a headache before you take. No, that is not the way to go. Oh, Fumi Made, welcome in. Saying hi, doctor. Hello,
Yeah.
Fumi. Okay, one of your people.
How are you, my she's one of my
Okay, I can see them
health
coming.
as well. Always after health.
That's good. That's good. Welcome, welcome, welcome. Where are you? Where are you joining from? Where are you joining us from? Okay, yes, thank you for the like. So everyone watching, we welcome you to the live. Let's know where you're watching from, and you can definitely like. Just look for the like button, like the live, share with somebody in your world. I'm sure there's somebody in your world that actually needs this information, and many people are actually interested in knowing what are these natural remedies. Can I take something without taking drugs? Can I deal with this blood pressure and blood sugar without taking drugs? Yes, you can, and that's why we are here. So, are you from this is Virgin? Okay, you know where we are now. I hope you can still hear me.
We can hear you.
Okay, we'll go for backup.
Okay.
All
So,
right. So I was talking about symptoms of high blood pressure and diabetes. So the fact is that when an individual begins to have headache, consistently persistent headache, throbbing, sometimes it's just one side there. Sometimes some people say it's related to stress. You know, it's not just going or it comes recurrently. Then some other people complain about feeling tired easily. People complain about hearing their heartbeat. These are not normal. You shouldn't be hearing your heartbeat, except maybe occasionally, maybe you have some anxiety, something happened that is scary. All right. So, but normally you shouldn't hear your heartbeat. Other symptoms of hypertension include chest pain. Sometimes the pain may just be dull and it may radiate. And when it begins to radiate to the arm or to the back, that's danger. We're looking at danger on the heart there. Okay, so some people, by the time it's getting to complications, some people already having swelling in their face, they are having swelling in their feet, and that may be affecting the kidneys already. Okay, so let's quickly move to diabetes. When an individual begins to pass urine excessively, frequent urination, especially at night, going more than 2 times to urinate at night, and that's nocturia, then sometimes the individual gets excessively thirsty. You are seeing yourself getting thirsty excessively, drinking a lot of water, or even eating excessively. Even with the eating, sometimes people are even looking, they are losing weight while they are even eating more. So I'm going to stop there on the symptoms. So I quickly mentioned the fact that it's always important to go for a checkup and get evaluated by a doctor if you have any of those symptoms. How do you know if you have high blood pressure? Your blood pressure needs to be checked. That's the way to go. And you don't wait till you are having that. I can see Madam Lola Faduga. I hope you know her. That's DDOD there. DDOD. Thank you for joining in.
You're welcome, ma.
Okay. She's a great supporter of this our channel. We always showing love. Thank you so much. Please share with your colleagues, share with family and friends. I'm sure they'll benefit from this. So we need to consider seeing a doctor if you have any of those symptoms. It's always good to have that checkup and don't make a diagnosis for yourself. Sometimes even that those urinary symptoms may be due to urinary tract infection, not actually diabetes. So, but you need a doctor to help you take a history, detailed history, do an examination, and then have a blood sugar test done. And then if it's fasting or random, depending on what is checked, usually it's usually above, definitely above normal. So what do we do next is to do further investigations to check for complications. And then some people are actually at the borderline. There's what we call pre-diabetes, and others borderline of blood pressure, high blood pressure. So we advise part of what needs to be done is lifestyle changes. Some people think it's all about drugs. I'm laughing because
Yeah.
now I'm a family physician, so it's not just about drugs. We yes, lifestyle is one sub unit of family medicine, subspecialty, and we do a lot there. All right. Welcome to Luashe Ajayi. I'm watching from Lagos. Thank you for joining me.
Dr. Toluwaṣe, welcome, sir. Those
Oh,
are
okay,
my people too. You're welcome, sir.
okay. Did you say he's a pastor or doctor? I didn't
Yeah,
hear that. He's a
pastor.
pastor. Wow,
Yeah,
welcome, sir.
passionate
Please.
about healthy living as well.
Wow, wow. Pastor, please share with people so that they can benefit from this. We like to have your like. Please like the live, and we increase the number of views. Okay, and more people can connect. So we thank you, sir. We need to understand that having this diagnosis is not the end of the world. Very importantly. So instead of running away, some people think, oh, if they make the diagnosis, they will place me on medications, and there are people that have actually done uh, intensive, what do you call it now, lifestyle changes. And what happens is that they now get a reversal of that borderline blood sugar or borderline hypertension. So their blood sugar becomes normal, their blood pressure becomes normal. But there are others who may not be able to do that. They may actually benefit from medications. Now, do you know that quite a number of people, especially on this side, even outside Africa, people are interested in what can I do naturally that I don't have to use this medication. Some people are not even taking medications because they feel or they know that they may have some, not just side effects, some complications from long-term use of medications. So a lot of concerns. So we are open. For me, there's, and like I said earlier, there's the complementary and alternative medicine, right? So, and it's about collaboration. It's about what is working and what has been researched to be working. Why can't we use it? So that's what I tell my patients. If it's working and it's not going to hurt anyone, why are you not using it? Let us use it now. All right. So we are welcoming you specially once again, and you're going to be helping us, sir, on natural remedies. I've done an introduction to what high blood pressure is. I don't know if you have any addition, high blood sugar. But what are natural remedies? We'd like to hear from you, sir.
All right, thank you very much. So thank you everyone. It's a privilege to be here. Um, we are going to start. I'm going to be revealing a lot of things in a very short time, so we have to follow. If possible, have your pen and your jotter to take down information because you will be seeing things that you will probably not find anywhere else because we have
Wow.
practiced for over 9 years now, been consulting, and so we have seen a lot of things. We work with patients, individuals to see how we can work, you know, in the complementary alternative world. What it means is that you come to us and you tell us you are, we diagnose you or you know already that you're confirmed hypertensive or diabetic. Then we will run some tests. I am a medical laboratory scientist as well. So, of course, I will recommend those tests for you. And after seeing the result, these are the things we will tell you to do. So, first, we are going to observe the things that the doctors have given to you. We are going to ask you, how compliant are you? Because if you are not compliant with medicine, with drugs, with orthodox medicine, I can guarantee you you will not be compliant with the natural medicine as well. Because you see, habit
That's true.
is superior to sense. Habit is superior to senses. So what it means is that even though you are in your brain, something is telling you this is not right, but you have to also realize that your habit becomes like another master that determines people who are smoking, they know that smoking will kill them, but habit is superior to sensibility or logic,
Mm,
because at that time you are dealing with your subconscious. So
mm,
it's the same thing. So in that same line, we have to be sure you are a compliant person to orthodox medicine. Once you are compliant to orthodox medicine, then we can prescribe other things for you. So
mm,
now, when we are sure that it's confirmed that you are dealing with diabetes or hypertension, then we will tell
mm.
you lifestyle. Lifestyle. There is something called the
Fish
DAS,
life.
DAS,
DASH.
yes,
Yeah.
dietary approach to stopping hypertension. So I'm going to give you the secret of that. It was, a research proven method of getting rid of, or let me say, managing hypertension without drugs. And let me also say this: immediately you resume some intense natural remedies, we begin to tell you to reduce your drugs, because those two, by the time you combine the natural solution to your orthodox medicine, it becomes too powerful, because both of them have anti-hypertensive capacities, and I'm going to prove it to you. You understand? Most of us don't know that those things that are inside your diuretics, that are inside your anti-hypertensive drugs and so on, they
Just a
are
minute.
in our, okay.
Please, let's share this with our family and friends, community. There's a lot
Okay.
happening here. Thank you, Sabrina, for joining me. It's just such a wonderful support, and she's also a content creator. Thank you for joining me. Great conversation. Well done, Doc. Thank you so much for the feedback. Please go ahead, sir.
Okay, so some of those natural ingredients that are inside the antihypertensive um, drugs, they are actually inside some natural fruits and vegetables as well. But we do not know. You understand? We do
Tell
not
us
know
more.
that.
Tell us, sir. We want to know.
Okay, so first, the first antihypertensive, let me use the word natural solution, is your grape, what we call your grapefruit. Growing up, we used to call it grape, but it's called grapefruit. Okay, that big orange that is not sweet. It
Mm.
contains some powerful anti-hypertensive agents. So what it means is that this is how complementary alternative medicine works. Now, your doctor says take this drug in the morning, in the afternoon, in the night. What you will do is you are going to take your drug in the morning, okay? In the afternoon, you will take your grapes, your grapefruit, you will blend it and juice it and drink it. All this have to be under, you have to monitor yourself, you have to monitor your BP. You
Did
understand?
you say
So
afternoon? Did you say morning, afternoon, or
yes, in the
afternoon
morning, in
only?
the afternoon, you take your drug in the morning, then you take the
Okay, okay.
grapefruit in the afternoon as your lunch. Okay?
Why?
Of course,
Why? Why can't they be combined?
we don't combine it because exactly what I said before, they have synergistic effect. It can
Very
extremely crash the blood pressure because it is an antihypertensive medicine as well, natural medicine. Okay, so it's very important for us to know that we will now tell you in the afternoon, we want to see the effect of that antihypertensive. So you check your BP in the morning, you take your orthodox medicine. In the afternoon, you blend your grapefruit as your juice. Okay, you take your grapefruit with banana. Banana contains potassium, and we all know that potassium is the enemy of sodium.
Sodium.
Okay,
Yeah.
when they tell you that, they usually tell people, they will say, they tell you that when you are hypertensive, you should be careful with your salt intake.
Right.
Okay, now there is something about salt and potassium. Salt is sodium chloride, and then
Right.
potassium is there. Immediately you begin to introduce potassium into the body. Now I'm speaking biochemistry, physiology now, into medicine and natural medicine. Immediately you begin to improve the dosage of your potassium in the system. Potassium begins to replace sodium, and let me tell you what they do. Potassium makes your intracellular water to come into the intracellular, which increases the blood pressure. We know that. But
Means sodium.
sodium,
Sodium.
pardon me,
You meant
sodium
sodium.
makes the water to come into the cell. You understand? But potassium does the exact opposite. Potassium makes the water leave the cells, and then you go and you excrete it. So that effect is working on the kidney, working on the cells, and working on the blood vessels. Can you see? So when you increase your banana and you take the banana, you blend it um, with your grapefruit,
Grapefruit.
you are using natural anti-hypertensive. You see, it's not contradictory. You are not using these dangerous herbs. You are not using this all those
All those leaves
toxic
that you don't know about.
herbs that are very dangerous for the liver and so on. No, these are normal things you could have even taken with your drugs. But now with knowledge, we know. Now, if you take it in the afternoon and you check your blood pressure 1 hour, 2 hours afterwards, almost tell you, if you are consistent with this, you will not need to take your antihypertensive drug in the night, because those two would have combined themselves to work together, and you will be shocked at what you will have in the evening when you are checking your blood pressure. Okay, now which brings us to your evening food. You should now not go and eat or eat foods that are high in sodium.
Where are
You
the
will talk
shawarma lovers?
and then you now come back to the doctor and say, doctor, this drug is not working. You are the one putting fire
That's
into
deception.
it. Okay,
Right.
so I explained that to you so that you can actually understand how we operate in our natural medicine world. Now let me give you a plethora of anti-hypertensive vegetables that just combine them a lot. If you do that, begin to reduce your dosage of and your frequency of your natural your orthodox drugs, and I can guarantee you will be fine. All right, so I will list them one after the other. Number
I'm
one
sure people want to
is
know. I hope we have our pen and jotters or your phone to type.
take note. It's
Yes,
on
let's
behalf
take
of
note.
the we are having this free of charge. If you meet me in my consultation room, you will pay.
Thank you,
So
sir.
you will pay. All right. So your zobo leaf, which is your
Mm,
hibiscus leaf,
right.
okay, your zobo leaf is very good. You should have one pot in the house, your teapot for zobo, exclusively for zobo. Just put the leaf there, pour the water there if you are hypertensive, and just keep changing the zobo, the leaves, and the water, and keep taking it. And once you see that it's not releasing that red colored product anymore, you can
Anymore.
change the leaf. Then you continue like that. Zobo drink should be part of your drink, no more soft drink,
Let's type
because
in
soft drink,
Zobo drink. Please go ahead. I'm
yes.
just engaging people.
All right, so the zobo drink is there. Also your
That's hibiscus flower, right?
hibiscus flower, drink it as often. See it, we have done a lot of research on it, and it has been realized that you can take it as much as possible. The body will excrete the excess, okay, and then it will work on your liver, and it will work on your blood pressure. Okay, because it contains those I don't want to belabor you with the clinical names and all those sites. They are there. You understand? They have done the research. Professors have done it
Yes,
in
it's the research
Nigeria
that has been
and
done.
they've done it
Right.
abroad. Proven that Zobo is anti-hypertensive. One of the things I want to digress to tell you why you should combine orthodox medicine and natural medicine in your fight against hypertension is because hypertension can be caused from different angles in the body. That is why those drugs work from different angles. Do you know that hypertension can be caused from the
Right.
kidney
Yes.
itself?
Yes.
You understand?
Yes.
Hypertension can be caused from the brain, from stress. Hypertension can be caused when you're taking too much diet high in sodium and some other hypertensive inducing activating proteins and molecules. You understand? So you can see that hypertension comes from different angles, and when you are from one angle, it can come from the other. That is where you hear, I've been taking drugs, it's not working. No, you have to turn it to a multi-dimensional approach. As you are working on your kidney, you are changing your diet, you are using your medicine, you are using your herbs, your natural vegetables, you are taking salad that is rich in avocado. You are taking avocado is anti-hypertensive as well. One of the causes of hypertension is also the atherosclerotic plaque, when the blood vessel
Right.
is thickened as a result of cholesterol and inside the blood vessel. So we need also to change your diet and move into what? A weight loss diet that will melt fat from your blood vessel. When we say weight loss diet, please let me add this. There is something called the visceral fat. Weight loss or fat melting diet does not mean that you are fat and we want to bring down. Yeah, that is a major cause, obesity. We are talking about fat in your organs. Some people are slender from the outside, but inside their heart is covered with
You're right.
fat. Their intestine,
Right.
so those are what we call the visceral fat, which people don't see. You understand? And those things can be there. Some people have this genetic um, you know, ability not to add weight physically, but they are depositing fat, bad cholesterol in their blood vessel, and that will also aggravate hypertension. I hope we understand. So, as I was
Yes.
saying, dietary approach to stop hypertension. So, what we are doing with is we have this list of food. Please use them freely. They are not against any drugs. Number one is your grapefruit. Number two is your zobo. Number three is your beetroot. Beetroot is very high in nitric oxide. You can Google it right now. What is the effect of nitric oxide? Nitric oxide has the ability to remove atherosclerotic plaque and to make the blood vessels to become soft and gymnastic again. You understand? So it's very good, and it contains beetroot contains some antioxidants as well. Beetroots are so powerful that when you start taking beetroot, you must reduce your drugs. It will crash the blood pressure. In fact, when I want to crash, this is a secret. When I want to crash somebody with a 250 over 110 or 120 blood pressure, I put you on beetroot juice. It is going to crash. That's where you will know that beetroot is powerful, is a powerful anti-hypertensive. You understand? So, but some people don't know it. It's becoming
Interesting.
popular in the
Like,
recent. You understand? So please, let's look for that beetroot. You should have beetroot. You can blend your beetroot with you can slice your beetroot and turn it to a salad. Just slice it into bits, into cubes, and dice it, and then add it to your cucumber, add it to your, lettuce and cabbage, and then you can take it as a salad. With that, you are already fighting hypertension, and meanwhile you are adding a lot of uncommon nutrients, anti-aging, antioxidants, into your system, which also helps you in your cellular repair, wound repair, aging, bone repair, muscle repair, blood vessel, vasodilation, and a lot of things. All right. So another thing we have on our list is the avocado. I spoke about the avocado briefly before, but I would like to also emphasize avocado, very important. And please, one of another bomb that is against hypertension I will release here exclusively is your magnesium. You see, if you look at the periodic table, all the potassium, magnesium, sodium, they are in the same line. What happens is that have high magnesium. There was a research that was done by several places all over the world. You can Google it, and I'm telling you, proven. They have found out that those with hypertension are depleted in magnesium. What is the correlation? So they began to realize that before you begin to pump antihypertensive into the blood of your patient, why don't you just optimize magnesium? That brings us to the supplement called magnesium glycinate, or what we call the tripartite magnesium supplement. What it means is the magnesium has different supplements that can be absorbed differently. So please, even if it is ordinary magnesium supplement, or you go for foods that are very high in magnesium. We have kale. It's not popular, but it's available in Nigeria. It's available in some
What do you
places.
call that?
Kale,
Kale.
kale
Okay, kale.
is very high
Yes,
in
yes.
magnesium, even potassium as well. Broccoli, broccoli is very high in, they are rare, they are expensive, but they are worth it. Why? We are trying to make sure that your body does not develop resistance against antihypertensives, because if you use less of antihypertensive and you adjust your lifestyle, I can guarantee you that you are going to live a better life, because antihypertensives have their side effects which you don't want to go into at all. So you should push more into the natural nutrients molecules that help the blood vessel, that help to balance cardiovascular health, your heart health, muscle spasms, and Dr. Sheyemi, you were speaking about people having palpitation, you say you can feel your heart. You should not feel your heart. You understand? You should not feel your heart. When you start feeling your heart palpitating, then there is something is wrong. You understand? So magnesium rich foods, I mentioned potassium rich food as well. Avocado is rich in magnesium, kale is rich in magnesium, broccoli is rich in
Just a minute, sir.
magnesium. All right, sir.
I don't know. Nobody should tell me they missed this in the community, even though we had a very short time to notify people. But I'm sure people watching are gaining so much. And it's not just about you, even if you are not dealing with high blood pressure or diabetes, you can help somebody in your world.
Yes.
So let's share this information, let's share this live, let's like, let's comment. um Thank you everyone who has been commenting. Sebuna, thank you for listing those fruits. We appreciate you. You can go ahead, sir.
All right. So one of the things that I want to mention is also garlic. Garlic.
Have you finished talking about broccoli? You were talking about broccoli. Are you
Yes,
done
I was
speaking?
listing all the products that have antihypertensive capacities. Okay. One of the foods that has, how many of us know about the omega-3 fatty acids? Omega-3 is very good, so we should cod liver oil. We should go for cod liver oil. There is also a supplement called coenzyme Q10. Coenzyme Q, take note of it.
Right.
It is one of the regulators of blood pressure, which makes you not to need the drugs, except we are dealing with somebody who is totally non-compliant and totally, um, you know, indisciplined. Understand? So I mentioned Garlic. Please let's take note of garlic. Very powerful. Just by chewing garlic, you can reduce blood pressure. Although people complain about the smell and
The
complain about the smell and so on and so forth. But please don't mind the smell of the garlic. Please go ahead and take a lot of garlic because garlic contains allicin, and allicin can regulate the blood pressure. All right. So spinach is also good. Also, spinach contains potassium, spinach contains magnesium, spinach contains nitrates, just like beetroot. So spinach and beetroot, we don't know, God is awesome, we don't know the family they came from, they have similar things inside them. So combining spinach and beetroot together as a juice, as a smoothie, you will not need much of anti-hypertensive drug because they contain those natural solutions. Now let me come back home to our simple food
did you
alarm.
say spinach and beetroot? Spinach and beetroot.
Combine as
Spinach
a
and
juice,
beetroot. Wow.
spinach and beetroot.
Okay.
Then when
Please
it comes
let's
to,
get our questions ready. By the end of this
yes,
lecture, we're going to be asking questions. So
I'm
let's.
rounding up with
Right.
our food. When it comes to eating food, which food would you like to eat that is going to help your hypertension? That you can even take it and then you take your drug on top of it. Okra, okra. How many of you know you can mix okra and bitter leaf soup together? That is a drug. That is medicine. That is not just delicacy. Okay, are you following me?
Yes, I think it's
That's
awesome.
powerful medicine,
Yes, yes.
anti-hypertensive medicine, and anti-diabetic as well. Yes, extremely anti-diabetic. It's about 70% anti-diabetic and 50% anti-hypertensive. Mixing okra and bitter leaf together to eat your okele, to eat your pounded yam, your eba, your fufu, your whatever you want to eat it with, it's awesome. Okay, cabbage also has anti-hypertensive, anti-inflammatory, phytonutrients as well. Garden egg, our garden egg is anti-hypertensive. You can take it as snacks when your BP is going up as well, and it contains fiber as well and polyphenol. All right, so I think for anti-hypertensives, I've been able to cover a lot. We have our pear as well. Apple is there as well. Guava is anti-hypertensive as well. So orange contains some little level. You know, I've mentioned the grapefruit. You know, orange, lemon, lime, they are all tangerine. They are all from that family of the citrus family. So any of the citrus family, but grapefruit is number one when it comes to uh, the anti-hypertensive. All right. So I think with that we have covered a little of the dietary approach to stop hypertension. We have your seeds as well: flaxseed, chia seed, fenugreek seeds, fennel seed. They all have this regulatory effect on your blood vessel. Then let me chip in, what are the things to avoid? You cannot be quenching fire. We have been talking about lifestyle adjustment, and then you cannot be quenching fire and be putting more fuel inside. So please, highly processed food. Number culprit is your white flour. White
Mm.
flour is extremely processed. White flour is different from the ancient flour in the Bible or in the ancient time. This one has been genetically modified and over processed to have that powder, and that is not healthy. Avoid using white flour. If you want to make your snacks, your pastries, use other alternatives. Use wheat flour. Okay, you can use rice flour, You can use wheat flour. There are other flours you can use, but avoid white flour. All right? Excess, let me say this, 90% of almost all the foods in our supermarkets are laden with salt and sugar. Our processed packaged foods.
Can you go over that? I know there's noise in the background. You said
Okay,
almost what in the market?
90% of the foods, packaged foods in our stores, 90% of those foods are laden with salt. Many of us don't read labels at all. We don't read labels. We should read labels, okay? And we will be shocked when you see the sodium content of our food. We don't read labels in Africa. We just buy those things because of their taste. I don't want to mention the names of those products because of company and so, but please, packaged foods, especially finished products, you know what I mean, whether it's a finished fish or finished fruits, refined snacks, biscuits, cookies, noodles, they are loaded with excessive salt. So you can see why younger generation are coming up with hypertension, because unconsciously we have become salt addictive society. You understand? And we must deal with that.
So
We must go for
addictive
natural.
society.
All right. So let's avoid soft drink. We know that all this shawarma, all those highly processed pizza, pastries, they are too. You know why you are going for them? Those additional, those what do you call them? Those liquid they pour on it. Those are salt loaded, and they are hypertensive triggering agents, even for
But they are
children.
tasty. But they are
They are
tasty.
so, yeah, is a leverage. You have to choose between taste. If live salt and sprinkle on their food in the name of tastelessness in order to get taste, those are corrosive habits that must be stopped. Everybody that is watching us, we are using this moment, this opportunity to tell you, never sprinkle salt. Never eat anything that has a sprinkled sugar or salt on it. That is a direct poison. And I hope you know that high salt intake can activate cancer as well, because it can disrupt cellular balance. I was shocked when I did a research and they said salt, too much salt can activate cancer. Can you imagine that? And we have salt society. So you can see the correlation between cancer, increase in cancer prevalence, and salt intake. You can see that. So I think for diabetic hypertension, that if you can do these little things that were mentioned, I'm sure you will not have any reason to actually take antihypertensive drugs. And if you will, it is going to be minimal. Even your doctor will tell you there's no need, because you are compliant, you are disciplined. Thank you very much.
Wow, 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 wow. Please let's appreciate him in the in the chat. If you have been here, I'm sure you know this is quite insightful, and we do not take this opportunity for granted. Please let's respond in the chat. I can see comments. Thank you, Sabuna, for typing in, giving us a list. So people coming in can see that. They say thank you, sir. Pastor Tuluala Shaja, he says wonderful revelation so far. Thank you, Dot. She says yes, okra and bitter leaf. I love it. Wow. Sevuna says she loves it. So no hypertension here. Okay. Somebody says Jibril Juma says, "Hi, great. More grease to your elbow, dog. Thank you." Island Galquemi. Hope I got that. Hey, dog. Thank you for joining in. So, Festus, I read it says, okra bitter leaf. Do you love it? True, Sebona, mayonnaise. Yes, so all those things that they put.
Yes, about the
Is that right?
mayonnaise,
So,
let's go for vegetables in place of mayonnaise. There is an healthy
go for what?
alternative.
We should go for what? We should
Vegetables.
go for what? I didn't get it. Veggies. Okay, 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 okay. Okay, I
Yes,
got
it's
that.
the healthy version of mayonnaise. It's available in such big
Mm,
supermarkets. Natural
mm,
dressing containing healthy condiments for seasoning and you know adding it to your salad for that salad dressing.
mm. Thank you so much, sir. So we want to welcome. Maybe there are questions at this point before we go to natural remedies for diabetes, right?
Yes, yes, yes.
Okay, so let's take questions. If you have any question, please let's remember to like the live and share the live. Let's have your questions for our guest. Any question at all is ready. Is ready. Can type in your question or comments. Okay, so I am going to start by asking what how do we go about the measurement in terms of, we talk about drugs, we have dosages for medications. So can it be too much? I remember you mentioned one that cannot be over consumed, but are there cautions that we must take regarding some of these natural remedies that you have mentioned for high blood pressure? Thank you, sir. In
All
terms
right,
of
thank you very much.
consumption.
In terms of consumption, your normal daily consumption should do. Avoid binging, avoid excessive anything. Even your normal orange juice will purge you if you take more than enough. I hope you know that. If you eat too much meat, it will purge you. That is telling you dosage. That is teaching us dosage as well. So it's very important that we take note for what we call pressure control. Pressure control, I think there's a note from someone. Pressure control is very important. Okay, portion control should be exercised in whatever you are eating. If you take too much meat, you are going to purge. If you take too much milk, you are going to have some issues. Sometimes you will even have constipation because your body is telling you are taking too much. So in the same way, when you want to take your beetroot, you can take your a cup. When I mean a cup, I mean 25 cl or almost like a 30 cl or 35 cl. You understand what I mean? Your soft drink, small soft drink bottle, you understand? 35 cl of any juice or anything you want to take, do. Okay? So that is one. Number two is that whatever you are taking, always make sure you are taking it in combination with other healthy alternatives. You understand? So you don't go on excessive something, combine it, go round different things. For example, if you do beetroot today, you can do zobo leaf tomorrow. You can do, your okra and your bitter leaf. I can see somebody that said they like it. You can do that as your normal lunch. Okay? Then you can do your zobo, whether for breakfast or for dinner. You space them like that. You become creative around those listed antihypertensive food because you are dealing with something at this period. You want to have results at that time. You want to see the needle moved. You want to see indicators that shows that your blood pressure is coming down because you are avoiding fatalities, and complications. So at this period, you are like, oh, this food for the next 1 week, I will be going through this kind of food. In the morning, I take my broccoli and my, cabbage. In the afternoon, I'll take my beetroot. I'll take my okra and vegetable before 7 p.m. in the night. You will be fine. I am telling you, is because we have not practiced it. The people who invented dietary approach to stop hypertension, they are not Nigerians, they are not Africans. It was a research proven lifestyle adjustment to regulate, and they saw that the thing is working. Even the Mediterranean diet, a lifestyle around people that live around the Mediterranean, they notice that the way they eat seafoods, the way they pick their fruits and their fresh options, they are living longer, and their blood pressure are regulated. Because if your blood pressure is regulated, I can guarantee you, if no other cause, for no other cause, you will live longer, because your kidney will last a lifetime and your heart will last. If those two things last you, you will be alive. You know, I studied longevity as well. Dr. Shoyemi also knows about that. If you see anybody that live long up to 100 years, go and check them. They were, whether consciously or unconsciously, successfully, they were able to maintain their kidney and their cardiac health. If they keep those two things healthy, they will not die. They will not die. But if you see somebody that is getting to 75, 80, and they are having issues in their life, check it. Most times it is cardiac issue, hypertension, diabetes, or heart problem, you know, because those things cut life short. So if you can target now and say, I want to live up to 100, I will eat this heart healthy foods, then you'll be on your way. Thank you very much.
Thank you so much, sir. Yes, we have to move fast now. Thank you for the likes. We can do more. Thank you everyone for engaging. Now there's a question for you, sir. Another question, and that is from somebody is asking: is lime water? Sevuna says, is lime water relevant in this case? Lime water.
Yes, yes. Lime contains is very high in vitamin C, and it helps when the antioxidant content of the body is high, it begins to regulate every abnormality. So it's good. Lime water also melt fat. Lime water also melt fat. Lime tea almost every day, almost every day of the 365 days of the year. Lipton tea with lime juice almost every day. I'm still going to take it tonight. You understand? So it helps you to maintain internal. Somebody is asking a question saying, what are the best food for a slim person who has high cholesterol? Move around and take a lot of lime water. All right? Beetroot can also do it. Portion control can do it. Avocado can do it. Please take note of the things I'm mentioning. Then take lime or lemon with your green tea. Add green tea to your lemon and lime. You understand? And reduce your rice intake. I take rice like once. I know once we mention rice now, Nigerians will frown at me. But please,
All right.
rice. Replace your rice. If you can get acha, it's in the northern part of Nigeria. It's the replacement for rice. It's very healthy. You
You
can
can
eat
get
it like
what?
that. It's called acha.
If you can
Acha.
get what?
It's becoming popular now. We've known it since 10 years, 15, 20, 30 years ago. You know, they eat it in the north. It's coming down south and west now. You know, reduce your rice intake. Take more of ofada rice, local rice. This normal white rice is cholesterol. Is cholesterol. All right. Reduce your fried foods, fried things. Boil your meat. Boil your fish. In fact, you can get rid of
Right.
meat for 3 months. You understand? You don't have to take meat. You don't have to. You can take fish in place of meat.
Right.
Reduce your rice intake. Take more beans than rice. More beans than rice. Boil your yam with the back of the yam. Boil your yam with the back. It will mop fat and excess things from your body. All right. There's also something else for you, but you want to mop up fat from your, increase your cabbage and your cabbage and your cucumber increase the intake of your cabbage and your cucumber. They are satiating. They can fill you faster. Then your body begins to melt the fat in your blood vessel to compensate for the need for energy. Then let me round up with this. Psyllium husk. Write it down. If you see me after now, you will pay to hear it. Psyllium husk. Psyllum. Psyllum husk is a powder from the tree. Okay? It's a very powerful. Did you get the name? Psyllum husk. Psyllum husk. Have you gotten it? Psyllum, then husk. Husk.
Okay.
Psyllum or LLUM husk. It's a powder, it's a protein powder.
Where,
It
where, do,
has the ability to mop.
where do we get that in Nigeria?
It's available in some natural stores and supermarkets. Psyllum husk is a powder. You add it to water, you can add it to pap, you can add it to yogurt, you can add it to your juice. Once it goes into the body, it begins to mop off excess fat from the gut. You understand? And helps to,
Pardon me,
it's a very
I want to start.
fiber um, rich protein, you know. So I think
Okay.
and take a lot of water. A lot of water will help you as well. A lot of water will help as well. All right. Okay. So we can
Okay.
take diabetic things now.
All right, sir. So I'm trying to ensure that um, I'm doing, I'm avoiding sedentary lifestyle. I think I've been sitting. I don't know how comfortable you are there. I think I want to stand for some time.
Yeah.
Yes, I've
You
not
cannot
been
do
doing
that
it
as well.
sir.
Sorry, you
Okay,
cannot
I
do that.
think. All right. So can you hear?
Okay.
There's another question on that. God is
I
really saying
think
something. Oh, let's read the comments. Interesting comments there. I want to read the comments before we move on to the next.
okay. Somebody said this is exactly what
Just
we told in church yesterday. I don't know, Shemi. I think
this is
it's where
exactly
you
what.
This is exactly what we were told in church yesterday. So I think it was where you went for your health talk. I'm sure most likely
Eh,
that person,
wow,
you know,
that's
person admit
that's interesting.
that's what she said. She said God is really saying something to us. Yeah, very true, very
Hmm.
true. Somebody said my
Okay.
grandfather died at 114 last year. Wow, wow.
Wow.
They said he didn't eat junk food. Can you see that? He didn't eat junk food.
Hmm.
There is
Hmm.
there's a story I was told by my healthy living trainer, my healthy living coach, the person that trained me. He said he studied some people in Ekiti. They met a man that is 115-year-old. The younger sister is
Yeah.
114. The one younger to that one is 110. And they are siblings
That's longevity.
in their family. And they said their father lived up to 120 in Ekiti before he died.
Wow.
And they said they asked him,
Wow.
my coach, my trainer, my mentor to ask them, say, what did you do? What do you people do? They said their father warned them, like in a covenant, that if they are going to live long, anything in can, anything that is can, in a can, artificial, they should not near it.
Wow.
And they know that the people I'm talking about, they still go to farm. 113,
Wow.
110, They still go to farm, they still do everything they want to do. Can you imagine that?
Wow.
That's many of the things that we are actually eating, many
Hmm.
artificial things that we are actually eating are the causes of our a lot of health challenges. So
Yeah,
very,
thank
very
you, Mom. Ajibike Jojosu here. She spells it for us. Thank you. Thank you
that's
for your
right.
support. We appreciate
Hello, me.
it. Yes, so always there to support. Thank you, man.
Yes, my number one supporter.
On mental health. I'm not sure she's there because she's been a member of my community. We are friends
Yeah.
on YouTube. It's exactly
Okay.
what way. So that means somebody else probably, I don't know, or maybe she was where I was, I didn't know.
Possible.
Okay, bless you, sir. Thank you so much. Beautiful self restraint is for success. Very important.
Yes. Self.
So someone says, Home Swat says, I have questions. Please go ahead with your question. We are going to go on TikTok some soon so that people can, on TikTok, people can actually come up to
Right.
participate, to ask questions directly. Apart from, YouTube is comments. Hopefully, one day we'll have opportunity to do that too on YouTube. But there are applications where people can actually do more than two people on the live. But this has been so interesting. But I know we are pressed for time, so let's quickly have natural remedies for diabetes.
All right. So first, we have to understand what diabetes is, and we all know that there is something called the diabetics genes, which is inherited from the family, and the diabetes gene
Diabetic
is
what? Genes. Okay,
gene.
diabetic genes. Yes. Go ahead.
What
Yes, sir.
it means is that the person is going to have the pancreas activity towards sugar and resistance to insulin. This whole process, what we call insulin resistance, insulin sensitivity, and sugar control regulation in the body, all these systems, that gene is going to be weak towards regulating them. And let me say this indirectly, the same gene that is controlling the diabetic issue, if it begins to weaken out and sugar is not metabolized properly, sugar will be deposited as fat as well, and then it leads back to the hypertension. So hypertension and diabetes, they are like twin brothers. All right.
Twins.
So for the genetic and then lifestyle. So now, when it comes to natural remedy, once the person has been confirmed, or let me say this, before you are confirmed as diabetes will give you a lot of signs. You are going to enter a stage that is called the pre-diabetic stage. The pre-diabetic stage means that you have um, hyperglycemia, but your glycated hemoglobin will still be fluctuating around the borderline. Even your blood sugar is going to be around your 115, 120, 125, which is still, it's a warning. Let me say this, at this point you
Pre-diabetic.
are within the reversible pre-diabetic episode. If you can go through what we are going to tell you today, you are going to reverse the diabetic permanently and go back to normal.
Wow.
But if you
Wow.
refuse and go to the permanent stage, then you become a strict patient, a strict diabetic patient. But there's still remedy, there's still hope. I'm going to let you know there are people that I know that we have been able to manage. They are no longer on any anti-diabetic drugs for years now. Why?
Wow.
I'm monitoring
Great.
blood sugar and they are following this diet I'm going to talk about. So the first thing I'm going to tell you about are products that have anti-diabetic capacities. Number one is cinnamon. Cinnamon spice. Now, when I'm talk about cinnamon, it is not that one that you are saying that the abokis, the Hausa people are pushing around in the wheelbarrow. Not that cinnamon. There are two kinds of cinnamon family. One is the Ceylon cinnamon, the other one is the cassia cinnamon. The cassia cinnamon is very high in coumarin, and coumarin is toxic to the body and affect the system. So you have to deliberately request for Ceylon cinnamon, Ceylon cinnamon.
C
That
E Y
cinnamon,
Ceynon.
Ceylon.
Yes,
That cinnamon has the
LON.
ability, it has what they call insulin sensitivity capacity. What it means is that it makes the cells to be sensitive to insulin. And we all know scientifically, medicine, when your cells are sensitive to insulin, they will take excess sugar away from the blood. But when they are less sensitive to insulin, they will leave blood sugar in the blood vessel. Sugar in the blood vessel can lead to cataract, can lead to diabetes, can lead to organ damage, cholesterol, affect the kidney, and all these things. Wound will not heal. You know all those conditions, you know that. So Ceylon cinnamon is very powerful. The dosage, please let me give you the dosage of Ceylon cinnamon so that we can follow
Please
properly.
continue.
The
Please continue. Just
dosage, it has dosages. It has dosage. Okay? 1 to 6 gram per day. So if you are taking it, you can take 3 gram in the morning inside the Lipton tea, inside your tea bag, your green teas, your black tea, and you can also have it inside your pap, you can have it inside your yogurt, you can have it inside your juice. Okay? When I mention juice, I don't mean fruit juice. Diabetic people should not take fruit juice. When I mean fruit juice, let me explain. No citrus, that means orange juice, no. It can increase your blood sugar. Okay? No orange juice, no pineapple juice. When I'm telling you about juices, people that are diabetic, please, I am talking about vegetable juices. Cabbage, lettuce, carrot, apple, watermelon. You juice it, you get the fluid out. That is your anti-diabetic juice. When I'm mentioning juices for diabetic people, please do not take pineapple juice, do not take orange juices, do not take all those combination of citrus, no. You can take the grapefruit juice, you can take lemon juice, you can take lime juice, but orange juice, no, because it can increase the blood sugar. Sweet fruits, please don't juice them. Sweet fruits, please don't juice them. If you are going to juice any fruit that is sweet, make sure it's a smoothie. Smoothie means you entire fruit and the shaft together. That will help your body to regulate sugar, glucose absorption from the intestine, from the gut. I hope I have made myself clear. This is I'm speaking slowly so that we can understand. Also for the Ceylon cinnamon, if you are taking the extract, is 250 to 500 milligram per day. 250 to 500 milligram per day. Please take note of this instruction. Ceylon cinnamon only. If you can't find Ceylon cinnamon, please don't take cinnamon for diabetes. Another second product I want to mention about diabetes is your apple cider vinegar. Apple cider vinegar anti-diabetic agent. Please take note, 2 covers of the apple cider vinegar with mother. Any apple cider vinegar you see in the market that does not contain debris, something that looks like mud deposit in the apple cider, please don't take it. It's just a salad dressing. Apple cider vinegar with mother, MOTHER, is the solution, one of the solutions that can help you to mop up sugar, glucose from the blood vessel. All right. So I've mentioned 2 products: Ceylon cinnamon, apple cider vinegar. I will mention the third one. I mentioned it before. Let's mention it now. Ceylon ox. PSYLLIUM. Husk. Psyllium husk is high fiber protein. When you add it to any food, it will thicken the pap. It will thicken your yogurt. Mix it a spoon to your yogurt or to your pap or to your water and drink it if you are diabetic. Take it in the morning. It is going to mop up excess fat from the gut, excess sugar from the gut, so that it will not be absorbed into the gut, so that it will not enter into the blood vessel. I hope you understand that. I have some other herbs. Bitter leaf juice, our normal bitter leaf juice, the water. Let me give you the dosage. Bitter leaf juice is extremely powerful anti-diabetic. It can mop up sugar from the blood. I use it when I see a patient with blood sugar that is going to 250, 300 milligrams per dl. I give them 35 cl of bitter leaf water, bitter leaf juice. So for those who are 10 ml of bitter leaf, 10, that is 5 ml times 2. Your adult spoon full is 5 ml. I hope that is very, because you can move bitter leaf juice can move you quickly from hyperglycemia into hypoglycemia. It is a very powerful, it works like insulin.
Yes, that's what we see happen to
It
some of our patients.
You don't want to see the danger of bitter leaf juice. Adult spoon of bitter leaf water. When they squeeze that water, the water, if you make sure you are diabetic and you are taking 10 mils of bitter leaf juice every day, I don't know how your blood sugar can go higher, and you are disciplined, your blood sugar is going to be normal. I can tell you that. I didn't say your diabetes will go. I am saying you will, if you are taking your readings. It's a mystery. The bitter leaf juice works, research proven, it works like insulin. It works like glucophage. So, bitter leaf juice. Then the bitter leaf itself, the leaf, make it into your efforiro. Add your pepper and use it to eat your rice. I'm giving you your menu now. If you are diabetic, ofada rice, black rice, basmati rice. Don't take the normal popular white rice. Take ofada rice with bitter leaf soup. If you are going to take white rice, very small quantity, with plenty bitter leaf soup with fish and egg. If you do this, you are going to be fine. All right. What else am I giving you? There is something called bitter melon. Some of you don't know it. It looks like okra, but it's big. Bitter melon. Okay, it helps to regulate. We call them low glycemic index foods. What do they mean? These are foods that has the ability to bring down excess blood sugar. There are foods that help us to bring down excess sugar. So bitter melon, it's called Momodica charantia. That is the name, but it is known as bitter melon. You can Google it online right now. You should have it as a salad in the house. Okay. Another anti-diabetic product that I will mention to shock everybody is your beans. Beans, all the kind of beans, every day. Moi moi, akara, beans in the beans form. You know, you can be creative with beans. Be creative with beans. You can take beans every day. Don't tell me you don't do it as well. Okay, so very important for us to take beans. Okay, apple is also good. um Broccoli, I mentioned. Sir, you said something. Okay. There are other ways you can use beans. You can bake your beans. You can boil your beans. You can make akara with. You can fry your beans. You can do a lot of things with beans. Do your rice and beans, plantain and beans, yam and beans. You know, just let more beans be in your menu. It is even, I'm not talking about diabetic people now. I'm talking every normal person, healthy person that wants to live long. One of the healthiest food on planet Earth that our Father God gave us is beans. It's a food you can eat every day for the rest of your life. If it's making you fat, it's making you to produce gas, then soak it overnight in water, then boil it, or peel off the back and still use it the normal way. You can peel off the back and still use it the normal way. Beans is a medicine, it's a natural medicine as well. So okra, I saw a white man, naturopathic doctor, trained researcher that was doing a research on okra, our okra. I said our okra so that you can feel jealous. A white man, our okra, telling, you know, man did not even cook the okra. He blended the okra and started taking it raw with straw. And YouTube started listing the health benefit of okra, our okra. We are taking our okra for granted and talking about diabetic and the medicinal power of okra. Understand? Indians don't play with okra. So okra is very powerful anti-diabetic and very healthy for a lot of things. Please, let's return, go back and take okra. We can add it to bitter leaf. We can add it to ugu. We can make okra alasepo. You know what I mean by that? You make it together. You dice your fish inside. You put crayfish inside. You put your crab inside. You put your crayfish, boiled crayfish and powdered crayfish. You put, you make it rich. Elemi meje. You know the way we say it in Yoruba. Okra elemi meje. You make it interesting. It's very, very healthy. People with diabetes or hypertension, elderly people should take. It's even good for the gut. It's a probiotic as well. It has a lot of medicinal benefit, okra. So anybody with diabetes should be free with your okra, with your spinach, with your bitter leaf. Cucumber, cucumber is tasteless. If you blend your cucumber and your apple together and carrot, please take note of this, as breakfast or lunch or dinner. Cucumber blended with apple, blended with carrot, that is a very powerful anti-diabetic agent. Okay, garden egg, I mentioned it for hypertension. It's also good for diabetes. Sometimes you bite some of them, they are very bitter. Some are neutral in taste, but you have some bitter garden eggs, they are okay. Make it into soup. Do garden egg stew. Make garden egg
Right.
rice. Use it to eat your yam. Let me shock you. Yam is anti-diabetic agent as well. Yam. Make sure you boil the yam with the back of the yam and
Not the one
boil
that some people add
with
sugar
the
to,
back.
table sugar.
Boil your yam with the back of the yam and sprinkle ginger, diced ginger with the back as well into your
Not
boiled yam.
sugar. Sprinkle ginger, not sugar, right?
Ginger, ginger,
Yeah,
onions.
some people sprinkle sugar.
Boil your ginger with the back of the ginger. Boil it inside your yam with the back of the yam. That is a, I'm giving you exclusive program. It will regulate the blood sugar. All right. So those are the things. I will mention others. Berries, berberine, berries, apple, pear, grapefruit, kiwi, kiwi, celery. You know, all these things I'm mentioning, they have what is called low glycemic index. They have the ability to remove sugar from the blood vessel. Why don't you use it instead of using glucophage? All these things I mentioned, be free with them. Okay. Eggs, boiled egg is very good. You know, boiled egg has been blacklisted that it can lead to cholesterol. No, 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 it's a myth. Is a myth, is a lie. Okay. Boiled egg is one of the healthiest food in the world. Boiled egg can help regulate. Boiled egg cooked, yes, whether half cooked or fully cooked is good. Boiled egg is very good for blood sugar. And to round it up, this afternoon or this evening, all your seeds are also good. Number one, sugar regulating seed is your fenugreek seed. Fenugreek seed, it can mop sugar away from the blood. Fenugreek, and it cleanses the liver as well. Please look for fenugreek seed. It's available in our store as well, but you can get it. Fenugreek seed. The second seed that is for anti-diabetic is chia seed. Chia seed has a mysterious ability. When you put chia seed inside water, leave it for 5 minutes, what happens to the water? The water turns to, like, becomes thick like pap. It becomes like egg white. That's what chia seed can do. Exactly what it does in the stomach. When you put your chia seed inside your yogurt or your pap or water and you leave it for 5 minutes, then you drink it, it becomes very thick. The moment it enters your stomach, it becomes thicker and it mops excess sugar from the gut and excess poison, fat and dangerous things from the body. It just mops it up and rolls it up into one mass and passes it out in the as the stool.
Interesting.
Chia seed mysterious. You can pick poison from the gut and take them and swallow them up. Excess sugar takes it up. Excess fat, HDL, it takes it up and swallows it and becomes a thick mass, and then what? It is passed out from the body as waste, so thereby regulating the blood sugar. Alright, so a lot of vegetable salad. If you are dealing with diabetic, here is a secret. Salad, let salad be part of your either breakfast, lunch or dinner. More salad, less cooked food. Vegetable salad of different, mention them. Your coleslaw, minus your mayonnaise, minus your salad cream. Coleslaw, you know what I mean by your coleslaw? Your salad, you know what they call salad? All your cabbage, lettuce, broccoli, cauliflower, kale, asparagus, all your salad. Please take salad a lot. Have salad at home. Don't forget apple cider vinegar. 2 cover of apple cider vinegar into 25 cl of water, half of pure water, half of your bottled water. 2 covers of your apple cider vinegar into your 25 centiliters of water 3 times or 2 times a day. Just keep taking apple cider like that. It is going to help your blood sugar. Be free. All these things I'm mentioning, develop them into a structure. I take this in the morning, I take this in the afternoon, I take this in the night. And then we can share the testimony on this program in future about what you see. You won't need any anti-diabetic drug except you are not disciplined. Thank you very much. Please, let's ask.
Wow. Wow, 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 wow. Thank you so much, sir. This was more like a more like a level of academic senior level academic presentation.
Yeah, yeah, it is.
But I appreciate the fact that our people were able to relate with this information. So much, sir. But before you go, I want to read some of the comments and questions. I'm not sure if you have attended to this. Please, are there dangers things that are used to make fruits even ripen? People are now wondering in these fruits, the GMOs that we're talking about, are we safe? So that's the question. The person is asking, are there dangers? Um,
All right. So about that, I know what you are talking about. Almost 99% of our produce now, because of pest control, maximum yield, commercial value, productivity, profitability, they have added pests, fertilizers, artificial things to match with them, sometimes to sprinkle them, sometimes according to Bill Gates, genetically modified seeds so that they can withstand pests and harsh weather. So those things have altered our natural produce. That is why it's part of one of the topics we are going to talk about on this platform: organic growing, organic planting, organic eating. So let's try and go for organic foods. Abroad, they will label all your foods into 2 parts. You will see the code, they are coded. You will see organic store on your right, then all the other plant store, you will know they are artificially grown. You understand? But we don't really have such here. But I will still tell you, to a certain level, let's still go for natural things. Going for pest control herbs is still better than poison, chemical laden, artificial canned foods and processed foods. I hope you understand what I mean by that. So Another thing you can do is to soak your vegetable with salt. Soak your vegetable with salt for some time before cooking. Another thing is to use apple cider vinegar, or to use vinegar itself alone. Add it a little into the water you use to wash your vegetables and your fruits. It does some mopping up to some certain extent of those chemicals, because we are not in, except you are doing your organic planting by yourself, planting in your backyard, which you can do, you understand. But if you cannot do that, then use some modern remedies, healthy remedies, to detoxify your herbs and because they contain fertilizers. Some of them are even genetically modified, which means you cannot, the DNA of that seed is faulty. They have altered it genetically, but still, you still have to eat fruit, you still have to eat vegetable. You pray, sanctify it,
That's the point.
than eating canned, all those. Let me say this here: baking. I hope we saw the news some 3 months ago. Baking, that meat that we eat inside hot dog, that thing they call hot dog, in sausages, in shawarma, in pizza, that meat bar that they put inside sausages has been labelled confirmed confirmed cancer, grade 1 cancer agent.
Carcinogen.
Is carcinogenic. Everybody should have, it was in the news 2 months ago. It has been labelled. Everybody should avoid it. It contains high sodium, contains poison, it even contains some crazy chemicals that are confirmed cancer agents. You understand? So please, let's practice organic eating as much as possible. Natural grown foods. Thank you.
Thank you so much, sir, for that response. Is palm oil good for our health?
Straight,
Palm oil good
original
for
palm
our health?
oil, very healthy. Let me use this opportunity to tell you the unhealthy oils. Any oil they did not tell you where they make it from. Vegetable oils are unhealthy. Vegetable oils. What do they mean by vegetable? What kind of vegetable? Is a word that industrialists created. Vegetable oils were made from industry, not from plants. Okay? Avoid vegetable oils. The healthiest oil in the world is olive oil, but it can withstand heat only a little. So you use it only after you have finished boiling food. Number one. Number two, groundnut oil, very healthy. Groundnut oil, it smells groundnut, you know it. Old oil, we can look for it. Number three, coconut oil, very healthy, very healthy. Coconut oil, it's not only for skin, not only for skin care, use it to cook. Number four, palm oil. Palm oil, very good. Palm oil is good for the heart, research proven. Okay. Number five, avocado oil. Avocado oil. Then we have sunflower oil, soya oil, canola oil. Please don't use them if you can. Don't use them.
Did they say don't use vanilla oil?
Canola, soya, sunflower seed, vegetable oil. 4 oils to avoid. Avoid them.
Why?
Go for coconut oil, olive oil, groundnut oil, palm oil, avocado oil. Please.
Why should those other ones be avoided?
They call them saturation at room temperature. What it means is that they can solidify at room temperature. We call them saturated fat. What it also means is that the same way they harden on the bench, they can harden in your heart, in your blood vessel, and lead to cholesterol
Professor.
mark in the blood vessel, and some other chemicals that are inside. Also, butter is natural from animal. Margarine is plastic. and it's not healthy. Some people melt margarine to make it into oil. That is poison. That is poison. Let's avoid margarine. Use butter. Even if you want to boil, use something to boil, use the butter. Fry, use the butter to don't use margarine. Margarine is just one molecule away from plastic. So will you melt your plastic and chew it? No, you won't. Margarine is a chemical, all right? So, but butter is butter. That's why butter is more expensive than margarine. Thank you very much.
Wow. Thank you so much, sir. And it seems margarine is used in making some pastries, some
It's all
used in
over.
making cake and all
Biscuit,
that.
cakes,
Wow.
pastry,
That's
all.
why that's why you need to be as much as possible avoid all
Yes,
these sugars.
yes,
Mm.
that's great.
Thank you so much, sir. I want you to answer this question. It's an interesting one by a doctor. I think is an academic doctor. Doctor, should let me guess this your colleague is a dietitian from Dr. Suleiman MON. Welcome, sir. Now you need to reintroduce yourself for those that were not here when we started, sir. So, and I will appreciate everyone. Please subscribe to his channel. He has a YouTube channel where he actually talks a lot more on these things. Please follow him. And if you want us to bring him again, let us know in the chat. We are looking at somebody asked about cholesterol and all. There are so many other things that we can talk about natural remedies. Thank you so much, sir. Please reintroduce yourself for those that don't know.
All right, my name is Dosi George. I'm a Assistant Director, Laboratory Services with the Lagos University Teaching Hospital. So I'm a medical laboratory scientist. I'm an assistant director, and then I'm a triple certified naturopathist. What it means is that I've studied natural medicine and certified both in Nigeria and outside the country. I'm a well been practicing both laboratory medicine and naturopathy. What we do in naturopathy is what we call complementary alternative medicine, not herbalism. We are not herbalists. I'm a
Thank you
born
for
again
clarifying that.
Christian. I don't
Thank
believe
you for
in
that clarification.
those toxic, dangerous herbs that they call spirit on. What we do is what is called the everyday vegetables. Many of you cannot distinguish those things. We can distinguish those things. Okay, there are some powerful, dangerous herbs. For example, your dongoyaro leaf is not a vegetable. Okay, that's why it is used to make quinine, hydroxychloroquine. Okay, because it contains anti-malaria substance that must be extracted. That is herbs. Okay, what I deal with is anything accessible under nature. Sometimes we use sunlight to cure cancer. Sometimes we use sunlight. We use lifestyle adjustment. We use diet modification. We use simple, we use what the same carrot that you are using, that you are eating as snacks, we can turn it to medicine for you. For example, if you drink your carrot, you juice your carrot and you drink it, it does something else to your body from just chewing it, but you don't know, so you just chew your carrot innocently. For example, your pain reliever, your NSAIDs, your non-steroidal anti-inflammatory, for example, your what do you call powerful pain relievers, anti-inflammatory drugs. Ginger can do that.
Ibuprofen,
Yeah, ibuprofen.
diclofenac.
Ginger contains what ibuprofen contains. Can you see that? But you
Yeah,
use your
it's
ginger,
inflammatory.
you don't know. All right. So, like that, those are the things that we do. We adjust your diet, then we give you healthy replacement of the unhealthy foods you are eating. For example, a doctor just gives you drugs and tells you to take this in the morning, take it in the night, and you are diabetic, and you are taking juice, or you are hypertensive and you are still eating your normal food the way African man eat. You are diabetic. hypertension or diabetes will not stop, but we will help you to modify those foods so that by the time you are taking the drug, you are taking your drug on a system that is what? Configured to allow that drug to work. So they call us naturopath. We use natural things. Sometimes we use a little coconut water is antihypertensive. Coconut water is anti
Wow.
contains electrolytes, magnesium, potassium, and some other mineral. Salt, you use your sea salt in place of your table salt. Your table salt is just sodium chloride. Your sea salt contains about 60 minerals that can regulate blood pressure. Sodium is there as well, but there are magnesium, zinc, selenium. Those nutrients we call micronutrients. They are so powerful at small quantities. They call them micronutrients. The body needs them to stay alive. We help you to, we modify your diet. So that's what I do now. I practice, I consult with people all over the world. As I'm talking to you right now, I'm not in Nigeria. All right. So, but I
Ah,
consult with people from different places, Australia, Canada. We have a Zoom meeting. You tell me what you have been doing. You tell me the food you have been eating in the last 1 week. I will tell you what is wrong with you. The cause of your problem is in your diet. You know, so that's why I have a
yes, yeah, what you eat.
yes, I have a program on TV, on YouTube called "Turn Your Kitchen to Your Clinic." Yes, when you follow our protocol, diabetes, stroke, hypertension, sickle cell, we don't turn SS to AA, but I can tell you to the glory of God, if you follow we have natural solution to sickle cell. When we put you on those solution, that sickle cell person will live his life normally without crisis. Although genotype SS is still there, but physiologically stable. I can tell you that. All right. So that's what we do. Thank you. It's a privilege to know you and to meet you, to be here.
Thank you so much, sir, for that powerful introduction. So, if you want, I don't know how we are going to share your contacts. There may be people that may be interested for personal consultations. So I don't know how you want to provide your information for that. Uh, for me, as a family physician, I encourage multidisciplinary approach
Yeah,
to care,
yeah.
especially
That
for
is
all these chronic medical. So dietary, lifestyle changes, including diet, physiotherapy, food and psychotherapy, and all. These are areas that we need to consider. Because of our time, I know we need to go now. We need to allow you. The seats have been written. Somebody asked, "Thank you, Mokwelala Adekunle Salami. Thank you, ma, for joining. I hope we can have more likes before we end this live. I'm sure we had quite a number of people joining. Some were not able to comment, but we could.
okay.
I think
Sorry
we
to
should have
interrupt.
more time to do
Somebody
this.
said, what of not? Not. Not. I didn't mention it because of
Not
time.
yet. That,
Nuts are good for
yeah,
hypertension
that's the next
and
question.
for diabetes as well. Your cashew nut, your hazelnut, your walnut, your coconut, all your nuts, they are healthy for blood sugar and for blood pressure. Please, whatever you are adding, if you are taking your salad, your vegetable salad, please add nuts to it. All right, granola, we have granola in our store as well. So granola is good also. All right. So and then use healthy alternative as your sweeteners also. Okay, so your nuts, cashew nut, groundnut is very good. Please forget whatever blacklist. You know the blacklisted palm
I have
oil,
videos on granite.
the blacklisted oil, the blacklisted groundnut. No, no,
So
groundnut
research has
is
shown that
omega 3 and
health,
omega 6 necessary for blood pressure regulation and blood sugar regulation. Please eat your groundnut well. Your forget the pimples matter. That one is hormonal based, skin issue, family is no. See, it's not like that. Groundnut, cashew nut, walnut, hazelnut, coconut, all the nuts are very healthy. You eat them as much. Add them to your vegetables and eat them as snacks. All right, God bless you.
Amen. We have to rush now so that we can allow it to go. We've been here for about 2 hours. Amazing. Thank you so much, sir, for your time. Now, there's the thanks so much, sir. Hi, Bola Oluwa is here. That's my sister. Thank you for joining in. That Milola Fadiga. Okay, she's been here. Thank you for the massive support, family support. Miss Era, you've been here. God help us. So, amen. Yes, please, let's have him again. Wow. So, sir, hope you're already taking our invitation. Please, what's his handle? You use George Dosu, right? Or Dosu
Yes,
George? What do you use?
George Joseph.
Your
Yeah,
Are you on
George
TikTok? We should
Joseph.
have you on TikTok too soon.
My
We should
TikTok
have
is
you
not
on TikTok.
really, yeah, I'm coming up on TikTok.
We need to
But
speed up.
WhatsApp,
We need to.
I'm very active on WhatsApp. I'm very active on WhatsApp.
Yes.
Anybody that
Yeah.
wants to reach me can reach me through WhatsApp only.
Okay. Do you
WhatsApp.
have your email address or you want to share? What do you want to share so that people can reach you? Or your
My phone,
number?
my
I don't know if
WhatsApp
you're
number.
okay with that.
Yes, my WhatsApp number plus two three four
Okay. You
zero
can.
plus 234 80 358 94782.
That was so fast. Please, can you take it over again, sir? Thank you.
Plus 234
Yes, that's the code.
5894782. 234 80 358 94782. That's my WhatsApp.
Okay.
WhatsApp only. I'm outside the country, so you can't get me by normal call, but WhatsApp call or WhatsApp chat.
Except you are in the same country. All right. Thank you so much, sir, for sharing. So I can see. Let's quickly read the remaining comments. We've shared the handle. Please, can you talk about dates? That's our dates master there. You know, he's into dates, so he's interested in we talking about dates. So we look for another time to talk about dates nutrition.
Yes.
Thank
Yes.
you. Noted. Sir Lubega Ajayi was here with us. Has been here. Thank you so much, sir. Family, thank you. Your what you eat and drink, choose responsibly. Martin Sibekun Kedu say thank you for joining. That's our coach, another content creator there. Hello Zenat. Thank you, sir, for joining. Thank you. Well done, sir. I cite you. Thank you for your support. My daily diet always contains this nutrition. That's good. You still
No,
come and
no,
share
no,
with us.
no,
Martin,
no.
tell us. Tell us what do you mean no? Know about what?
Don't make it. Date is sugar alternative. It can also increase the
Mm.
blood sugar. All right. So no, date reduce it.
He is talking. Yes, you should reduce it. Yes,
Reduce it.
very
It's
important.
good. It's the alternative for
Everything has
sugar,
to.
but please reduce it.
Thank you for that, sir. My mom's sugar level fluctuates every time, sir. Please help me. Oh, come to. You can chat with me, meet Era, and then you
Yeah.
can also contact him. And
Yes.
let's see, because you need proper evaluation. What exactly
Yes.
is happening? What are the other things to be considered? And then it's a multi approach that we need,
Yes.
multidisciplinary approach. What's ulcer patient? Okay, we'll talk about ulcer some other time. Diet for natural remedies for ulcer patients. How do you do it? We don't have all the time today. Thank you, sir. Thank you. Thanks so much. I've noted the lost down. Thanks for the number. That's good. Thank you, everyone. Who has
Thank
not
you.
liked this live? Can we have one more like so that I can reach 10 now? Amazing people. We appreciate your presence. This was a short notice, and then we had massive attendance, and I've learned a lot, and it's going to also help my practice as I relate to my patients more. Thank you
Yes.
so much, sir, for coming,
Thank
and
you for having me.
we wish you a pleasant evening, and we see you again soon. Any closing remarks?
Thank you very much. Make sure you eat healthy with knowledge. Don't eat by emotion. Don't eat by class. Eat by knowledge. Find out what healthy things, and from now, let it be more natural things in your food than cooked food. And with that, you will be on your way to a good health. Thank you very much.
Thank you so much, sir. Many thanks, boss. See feedback from there. Thank you so much, sir. So you can exit at any time. You can leave the live session at your
All right.
convenience. But I want to invite people to subscribe. If you are seeing us for the first time, subscribe. If you are yet to subscribe to his channel, subscribe to Dr. Sheyemi's channel, and that way you will get connected to us, and you can relate better with other members of the community. And when we have programs like this, you can have access, easy access. You'll be able to get notified. You need to actually click on all notifications. When you click on your subscribe button, click, click on it again, and you see the options for all notifications, and you get to click on that, so you'll be notified anytime there's an update in the community on the channel. So let me know if you want us to do this again. How often do you want us to do this? We may have other professionals coming to share with us, and that's important because um, being healthy, staying healthy has many things to do, and if you are going to do the things that are important, definitely you're going to be staying healthy. Not just healthy, longevity would be something that you're going to enjoy by the grace of God, and that's our portion in Jesus' name. Thank you everyone for joining in, and next time you see notification, remember to join in immediately so that you can fully participate. And if you are coming across the channel for the first time, please, apart from your subscription, you can watch videos. There are videos there. And if you are an old timer, you are an old member of the community, there are videos that you might not have seen. I have new videos on the channel, and let me get your feedback on those videos. Thank you once again, and I'll see you again soon. Bye for now. Amen.